Hello everybody, my name is Tarek and I'm going to be talking about single dose Oritavancin in the treatment of acute bacterial skin infection. Definition: Oritavancin is a lipoglycopeptide with bactericidal activity against gram-positive bacteria. Its concentration-dependent activity and prolonged half-life allow for single-dose treatment.
ABSSI, or acute bacterial skin structure infections, have a huge economic burden for our hospital, along with a huge clinical burden. Many times patients have to get admitted, and a lot of times they require IV therapy for a few days, and they get discharged and requires the patient to take oral antibiotics. This requires the patient to actually take those antibiotics, and sometimes that doesn't always go as planned. The economic burden for these infections is large in the sense that they get admitted and a lot of times readmitted for that same infection. Oritavancin and vancomycin are similar in what they cover. They both cover gram-positive organisms, including staph and streptococcus skin. In terms of administration, though, oritavancin is a single dose, whereas vanco has to be given either once or multiple times a day, depending on the patient's renal function.
Applications in medicine: as I said before, Oritavancin is a lipoglycopeptide antibiotic with three mechanisms of actions that result in concentration-dependent bactericidal activity against clinically relevant gram-positive pathogens. Oritavancin has a prolonged terminal half-life and its excreted change in both urine and feces. No dose adjustment is required on the basis of age or renal function or for patients with moderate hepatic impairment.
The glycopeptide class, which vancomycin is a poster child for, has certainly been around for a while. Over the last, it's been a while now, maybe 20 years plus, there's been a development of the lipoglycopeptides. Hence, the name lipo shows that they have a long lipophilic side chain that provides a number of different features associated with them. From a clinical perspective, those features are noted in terms of much more improved lower what we call MICs, concentration levels. So, for example, where vancomycin may have an MIC of 1 to Staph aureus, this would be 4-fold lower, 0.012 lower in some cases. So you actually, to say you have more activity, you just have much lower MICs, which provide just better killing. You have marginal tissue distribution, which can happen in the product in abscess-based areas. So it allows for certainly that. Another feature is with that lipophilic side, or the lipopeptide cases, you actually have a very long half-life. So very often that half-life is greater than 7 days. So you can give a single dose of this antibiotic IV and then walk away, and that the equivalence of 7, 14 days of IV therapy. So again, it allows a nice option rather than having someone come in getting the standard of care of vancomycin, twice daily IV. Give them a single dose of dalbavancin, they get their dose, they're now sent home, and that's the equivalent of 14 days of IV vanco.
Pros and cons. Pros: single dose treatment for acute bacterial skin structure infections that result in an early and sustained clinical response could have the potential to reduce the complications associated with multiple intravenous administrations in patients with these infections, improve adherence to treatment, improve quality of life, and reduce the utilization of healthcare resources. Cons: whereas the extended half-life of Oritavancin provides the physician with a single infusion option for treatment, it also raises concern about extended illness should a serious reaction to this antibiotic occur.
Now, you did mention we had some new agents coming up, and I promised we'd get to them. So there are at least 2. Let's take a look at these guys. There's a dalbavancin and Oritavancin, right? What's so special about these drugs that we're talking about them today in this?
Well, what makes them special is that they both have activity against the relevant pathogens that are the most common causes of skin infections, which are the gram-positives, the strep, and the staph, including MRSA. And so their spectrum of activity is very relevant to skin infections, and both are indicated for acute bacterial skin.
These are
infection.
lipoglycopeptides, right?
That's right. And so there are like, in a sense, a new generation vancomycin with some additional properties. And of course, what makes them most unique is their very long half-life that allows the entire course to be given in one infusion.
The entire course in one infusion. What does that mean?
Well, it means that once you are done infusing the antibiotic, you took away the need for IV antibiotic as an indication for anything. We just had a long discussion about the fact that many patients get admitted from the emergency department for the sole reason of requiring IV antibiotics. Once you gave them the last drop of one of those two, Oritavancin or Bacterial, by that you took away the IV antibiotics. You took the one indication for admitting them, and now there's no reason to admit them. So that's only one example for that. Another example for that is that if you compare them to a long course of multiple times a day, adequate antibiotic like vancomycin, for example, their effectiveness is equivalent.
Let me be sure I'm hearing this correctly. Maybe I'm not. Their half-life is such that if you give them one dose, they don't have to come back ever again for more antibiotics, or it's one dose is good for them. Yeah. What do you say?
It's one dose, and then they don't have to come back. You gave them all of the antibiotics that they needed, and they don't have to get any additional antibiotic therapy.
Issue applied in Ecuador. We basically use it for the same thing because it's been found to be effective in treating infections caused by bacterial resistance to beta-lactam antibiotics. As I have said before, Oritavancin has been shown to be effective against gram-positive organisms. Conclusion. Clinical evaluations were performed at the following time points: 48 to 72 hours after the initiation of the study treatment, which will be the early clinical evaluation; day 7 to day 10, which will be the end of therapy, or in the case of early discontinuation, the day the patient stopped receiving study drug or was switched to a non-study drug for primary acute bacterial skin structure infection; 10 days after the initiation of the study drug, and 7 to 14 days after the end of therapy visit, which will be post-therapy evaluation. That takes us to a final conclusion, which will be a single dose of Oritavancin was non-inferior to twice daily vancomycin administered for 7 to 10 days for the treatment of acute bacterial skin structure infections caused by the gram-positive pathogens. That will be everything for now. Thank you for the time and attention.